Nalolo is among the newly created districts in a country that is only just beginning to implement decentralization. Divided into the eastern and western side of the Barotse Plains in the western province of Zambia, with a distance of about 29.8 kilometers from Mongu town, it's a vast but sparsely populated district with wards namely Kambai, Kataba, Liamakumba, Makoka, Moyo, Nanjucha, Shekela, Silowana, Likulwe, Okolo, just to mention but a few. The district has a population of about 60,000 inhabitants, with fishing, subsistence and pastoral farming as the signature agriculture activity due to the availability of the plains. With all that mentioned, the district is under-resourced and lacks capacity to deliver its mandate. Funds are not channeled from the central government to the newly formed district. And with what is available, water is not prioritized despite its vital role in economic development. This is partly because those who participate in decision-making processes are frequently slightly more affluent men with access to safe water, whilst those that are frequently excluded from decision-making processes are people living in poverty who lack access to safe water. Kataba Ward, with a population of over 4,586, is one of the wards that has benefited from the DTV Water is Life project.
My name is Nalolo District, the school manager for Kataba Primary School. Clean water has been one of the benefits that the school has benefited. So we find that most of the time, our pupils spend most of their time here at school. That is 5 days out of 7. So they spend most of their time here at the school. So as they are at the school, they need water for drinking. So the pupils used to drink water which was contaminated or which was not even safe for drinking. So with the coming of the water at the school, you find that at least the pupils are able to drink water which is clean. And drinking clean water has improved their health, because if they drink water which is contaminated, at least the pupils had been experiencing sicknesses which come as a result of drinking water which is not safe. Hence, that one had an impact on their learning, because pupils would not come to school because they are sick. So health has improved. Hence, it has impacted on the attendance of the pupils. Distance from the school going to where pupils used to go and fetch water for drinking or even for cooking, at least has reduced. Action Aid has played a very big role in facilitating the coming of water at the school.
I'm Nalolo District, a teacher from Kataba Primary School, and there's water now at Kataba Primary School. Ritumeza huru kuba Action Aid baba rutiseze mezi ya akakuli no kusina mezi famu chokocho. In short, there were no boreholes. But now we have this borehole. Now we are enjoying water. We are not fetching water from far down there where we used to fetch water from Konakuri. Lwa utwa hande luli. Mirusa bata kulimane kakuba mushemi wa musari chwana. Niba nake babari teni. Kulikambe nolukakona kuswaisa na hamo niba Action Aid. Kurubereksa ne hamoho barukone kurutusa hape mwali kaze muzebona akuri zakona kurutusa kakuri fa mapipe ama aiteni mwateni azusama fume kona kurutusato kwa hape kuri barutuse hape kwa 0 pili ya mezi nize muchwalo rushwesa ne hande chwe itumeze huru andi naze ngata nilakazafera kuli musike mwakutamwa mulao mulutuse kwa ma project amamo ako nakwezala fast korofa
mavizo akakutala kinana memo mbotwa kwali nakoza kwa mulaho nolunyanda hulu nolunwa mezi amasila mamasima akuichepela nolukona kunwa nilifolofolo linja maneni mawawa nizola nilikona kunwa mamezi oluseli kunwa kono kuzwa 2016 fava tulokalela va Action Aid vatu oluluta moluswanela kunwela mezi akenile vatu oluluta kwapeha mezi kulilituse kunwa mezi akenile sabuveli vatu oluluta kuveya kulolini mwa mezi twafate ne valulutile kuveya mezi fakazazi kwa kwahela kamuko ochwalo sali va Action Aid valutiselize kalulo yemu yazolopili kwa mana kalipompio na michokocho kwa sipatela na unani maproblemu amangata hulu kwa mana kamezi suhulu kwa kalulo ya maternity tuafate na unani kalulo ye maswa hulu vasikolo salu na sakatava vanana valunana vachalicho vasikatapa kwa mazoho kono fakuzwa fapatiloezela va Action Aid valutiselize mezi ni vasi SPR kana koyo abakopanile chwalo kashekule valutiselize michokocho faskolo manene kwa sipatela manene famuzi wa malungi solunwa mezi akenile manene mabasa aluna bana balikolo kamuko chwalo lufumane kuli valweze zolopili yetuna yalutabisiza hulu ni haiva bashemi va Action Aid ni basi SPR manene bona va DTV haiva basazwela pili nolukupa kuli bakono kulutusa nsuhulu kwa manani una basali kulikambe lupanga maklabu maklabu mo balutuse mwateni mashereni kwini una lukone kumatamata matamatela baba mwali bakazemu mi ntwelu tise za hulu butata mwasi bakasakataba kikutokwa mulukona kufumanela mali nikuli luzuse bana bauna pili kwa skolo kamuko ochwalo lwaitumela hulu kwa kalulo yalikuwa tadeta luze kulufaliseli leli kumafaha kwa nunukona kwa kataba lwitumeza hulu.
With the help of Action Aid Zambia, the villagers were taught and trained on how to maintain and renovate the boreholes in case of any damages through the introduction of village washers that are made up of area pump menders. The washer groups ensure that all is in place in different water points. The menders also make contributions for the usage of buying new pump materials. This has brought so much relief.
Then kuzwafo faita bazezi zwe kafaze lutabezi kitabe yakuli usakupa ape kuli bataya ape bona ba Action Aid kuli akona mwami nzinyana esiyezi yeruna niona eshina mezi mwendi bako na kutusa bagesa kuli bungata wabatu wabaite maminzi mose so bapera kimashenya kulifa kwa kanso kono chwale mwendi bona bakata kutusa ngwa tusaiza ba mwendi bako makakopa na mwendi meza masimalo na alipombe akaekeza kwa tena kuzwa fo kwa itusa tukupa kikuli lunani skolo sabuna nsona fa maruti bana nibona kiba inyani mandu bakensa accommodation kwa spatela bakensa accommodation kizemu zilu kupa kuba Action Aid kopa ne ba CSPR kuli balutuse kuzona ndani fita fo
mavizo akakakutala kinapumulo mwenda bayi kansela wakataba wadi ni safitsa kubulela kwa mana kamisebezi ezalile mwa wadi mo kwa mana ne Action Aid amwe ne CSPR kwa mulaho ne lunyanda hulu kwa mana ni mezi si hulu basali ne bakataze ya hulu faine kula mezi ni mwanako ya chwale ba Action Aid abatirofita kutokona kutolutusa kwa manani mezi lukoni kutofumana sesimu sesina libunolo bakensali pompize balobezi kwa mulaho ne lukatazea kunwa mezi kopani anili follow za mamishitwa monza mwalibala bakensa kukatazea mezi chene mwana kwa chale batilo lupangela mezi batilo lupangela michokocho lukona kufumana mezi kabunolo mani hamuho ni kunwa mezi yake nile kutua 4 nisakupa kubona ba action aid bakone kulutusa sinakababona skolo sawo na mosi inezi kiskolo sakale konwa sibona ali kwisazwe la pili chwe kalu kupa kuli balwekeleze kwa mando wa maluti hamuho mana ni classes aluna kiakale amamu ayo handi nisakuta happen kwa spatela bakone kulutusa kwa maternity ward kwa ali amuho ni mandu abalafi babataha abanamba kona kuina mandu kyama inyani bakopanela mandu kwa spatela ni kulutusa hamuho ni pompi ya spatela nina yakatazanga fukumu yasho fukumu iketile cheke alukupa kuli bakone kulutusa amwa kukona kulufela hape mwe kubona hala kuli yakona kubahandi kimwana ko yachwale hape nisafitsa bwitumelo kubona ba action aid kamisebeze bakone kulutiseza na haya kataba itilo bona kuzwela pili bakensa misebeze ya ba action aid choleka hon fitsa bwitumelo hanina zengata za kubulela bwitumelo bobutuna buye kuba CSPR amo ni ba action aid ka programu ya Nalolo Water Project nitumezi.
An improved health system structures the future of a community. According to one of the health representatives in the area, they receive about 133 pregnant women every year. The health personnel at Kataba Health Center also spoke out on the positive change the DTV Water is Life project has brought.
We have clean and safe water whereby even our patients, they have access to clean water. The diseases like the diarrhea diseases, they have reduced with the coming in of the handy pumps. Because as the health facility, if people have got clean water, meaning they will reduce on the diarrhea diseases and these other communicable diseases.
Kinaka buku simonda nizo mumuzo biswa malungi nelunyanta hulu mwamuzi waluna moka kuli kuzwa funo luyinzi kuzwa kwa nuko nduku ya kukamezi noluzamanga 30 minutes kwa kona kwa kamezi kwa lisima kono kachwalo 2016 so twamwe ba action aid kono kwa Kataba mba action aid bao sabatolo lutanga makete mani ni mezi chwalo mama wa action aid kwamba uteze pompi ona ifa Kataba fa mama lungi mo kona utulitumezi ya hulu kuzwa kwa action aid mani basikiba feza fa kono mani kupaka kuli muso ulutusi lokona kutokopana hapa ba action aid kuli balupangeze muzefitafa kakuli noluzia lele bana baluna masiki noluna meza kuli ya green ama muki orange chwale kialu kupatuso kuba muso kulishangwe ulubone kwa Kataba usikwa feleza fa zezo satoka kizengata ne fast colos kosa naluna mandu kaufera ni kwa spatela kuna mandu ni babeleki baluna kutwa fo kwa malungi kapaka tabayo kaufera lukone kupanga ma toilet nduni ni toilet yayona kwa maana kama kete litutileona chwale kialu fusa bitumelo vo kwa fulufeleza bitumezi
nalibizola kakina mbita nzo mamunzo wa malungi mono nyanda lumezi ko kanga uli kwa njelelo ko litumeza kuba action aid kone kuteza pompi mamunzi waluna mono nyanda ulu kakuneke matuku nolukona kukula matuku ya shutana kakuli notokele mezi no mezi ya masila cho litumeza ulu kuba action aid kuteza pompi mwa malungi mo kono maikuto yaka oshangu.
The Nalolo District Council, an organization involved in implementing many other projects in the district, pointed out on some of the key factors on ensuring that there was a continuous working relationship with Action Aid and many other stakeholders.
So in order to ensure that this working relationship with stakeholders like Action Aid, we saw purpose is also to help alleviating poverty through the supply of these water supply infrastructure. The council wishes to work hand in hand with these stakeholders in order to ensure that where the council fails to meet its obligation in terms of supply of water, the Action Aid and other organizations can also come in and supplement the government efforts.
Expecting mothers and the girl child are in no way an exception, as it is of great importance for them to have access to clean and safe water. Different members of the communities, starting from school-going children, health representatives, community leaders, ward councillors, women group representatives have also expressed their concern on the need to access of safe and clean water.
We had a big challenge in Moyo, whereby we had to travel long distance to fetch water. And in this case, our girl child had a problem due to this water problem. I think there is a great change. Things have improved. Now we have water in our society, though the water is not all that clean. It is not all that good for drinking. Since Action Aid came up with this program, our children, especially girl child, are able to go to school early. Since last time, in the past, they used to go for long distances for them to fetch water and come and bath, go to school. Now for this time, they are able to go to school early. As women, we can go to the fields, we come back, you fetch water. Though our water is not yet clean, but we still demanded for clean water. And now there is a project which is undertaken. They are trying to put clean water. They are moving the borehole from where they were to the other side. Our boreholes were at the east side, now they are going the west side, where they will find clean water. And Action Aid have installed some boreholes in different areas. I think I really appreciate Action Aid as it works with the government, so we still need its help. We need them to help this community, as we still need a lot of things in our community. It is not only water that we need. Schools are there, they need to be built. There are so many things to be done in this community. So we really appreciate, and the Action Aid doesn't work alone. It works hand in hand with the government for today. So I think we still need it to collaborate with our government, to work hand in hand with our government for them to develop our area. We still need their hand.
My full names are Ernest Msenge Mahongo. I'm the area councillor of Moyo Ward in Nalolo District. I appreciate the efforts that Action Aid with the water project in their programming had done. Initially, our situation was bad in terms of access to safe and clean water. The people here did not know of how to clean the available water. The water project funded by DTV, we have seen something good, because one of the water sources in this ward, which is at Naswayo, was done from its funding. We have also seen people utilizing the trainings that they have undergone in water purification. A lot more we have learned. Even the trainings of water harvest. There is one man who does it from the same community in Moyo. He does harvest water since then. And I think they also touched some parts like how we can clear our canals so that we can have a good flow of water. That have helped us so much. Organizations like Action Aid, it should still remain in this area, because I've seen how they interact with the people, the way they get down to the ground and deep into the community. It's very, very good. Their input is so much appreciated. And I've seen some other projects or programs that they have been running. They have viewed positive results. So I strongly feel that Action Aid should still remain and operate from Nalolo. And to be precise, if I cannot leave my ward, Moyo ward.
My full names are Frida Wamumo Naponiso. I'm a student action group member. Before Action Aid came into our place, which is the Moyo area, as women, we were drinking dirty water because we use unprotected wells. Even if the running water is here, but it's not everyone who can afford to pay for 20 kwacha every month or 100 kwacha, one kwacha per tin. So we have challenges, and also we didn't know our rights. That even when we have a problem of water, because we didn't know our rights, we were failing to go even to the council to talk to the council. So we had a lot of challenges before Action Aid we come into our area. After the Action Aid brought the project, the Nalolo water project come into our place, because we have been trained as women in women groups. They have taught us how to go to the council, to talk to the council. We have known our rights that we have as women. From what we learned from Action Aid, as a woman now at the household, I can drink clean water by using chlorine, or taking a 20-liter container, putting it in the sun, so that the germs can be out there. So even now, I can teach my children how to drink safe and clean water. As for now, we'd like the Action Aid to continue, because in our area, it's not only this ward only, but there are so many villages who are drinking from unprotected wells. So if they come up again, they can go into there and help them, teaching them the skills of protected wells.
Before this DTV project came, as youths, we were most suffering in terms of water. But right now, there is a big change, because, for example, from the points where we were collecting water and from where we are collecting, some of the villages or some of the communities or households, they are now collecting water from far place, from nearby places. Only that, we are also still asking Action Aid staffs to continue, so that we may have a lot of change in terms of water. For example, some of rural areas, maybe some of the school-going children, from the schools where they are going, they don't have protected water, which is not well.
I would want to appreciate Action Aid for helping the women in Moyo, because from the time that they came to work in Moyo, I've seen a lot that they've done to uplift the livelihood of the women, more especially on the trainings that they did pertaining water. So when I say the trainings that they did the training where they were taught how how they can boil their water, how they can use chlorine for the water to be safe to drink. For those that cannot afford, they were also taught they can put water in a 20-liter container and put it outside where they don't need anything, so that at the end of the day, the water that they drink is safe. I can also say the trainings they undertook in the governance, the women, they are able to demand for their rights. Because like when we talk of water, when the water is not clean for them, they are able to stand and go to that particular department which looks after water to go and demand for their rights. And not only water, there are some other issues a lot where the women can come to various departments to come and fight for their rights. So for me, I really appreciate that Action Aid has brought all these trainings to the women so that they are able to stand on their own and fight for their rights.
This office has been very instrumental in the sense that issues that come to the office also reach the area member of parliament for his attention, and also can contact other government wings and also other stakeholders for the benefit of the people. In this case, we have been receiving quite a number of complaints over water issue in Nalolo, starting from Kataba, Moyo, and Nanjucha, including in the other 7 wards on the western side of the constituency. So we have been receiving these and also forwarding them to the sitting member of parliament for his attention. And it has been very overwhelming, such that it has been receiving the needed responses. So there is need really for people to be aware of what is going on in their locality, more especially that when they have their representative, all issues that pertain for his attention are also brought to the office. And in this case, we want to appreciate what Action Aid has really done, more especially in the governance issues on how to deliver their issues for the attention of the relevant wings of government and other stakeholders. It is through the issue of water whereby the committee members came and brought their issue, their complaint over on how long the project will take to be completed. And in this case, we are finding that the Honorable Member of Parliament for Nalolo also even asked the Minister of Water Development and Sanitation and the Environmental Protection, whereby he asked about five questions. And it was at that time that we found that government then came in and then directed the Western and Water and Storage Company to make some headways in the provision of clean and also clean water in Nalolo. And it's at that time that also the PS also gave that direction, say this should also go along with the removal of iron content in the water system. So we appreciate that things are really being carried on the ground, more especially when issues are brought to an office like this one.
With the high unemployment levels in the country, entrepreneurship is at its peak in the western province of Zambia, as a vast number of men and women have ventured into different businesses such as selling of fresh fruits and vegetables, rice production, transportation businesses, mobile money services, just to mention but a few. Nanjucha, with an area of 440 kilometers squared, is one of the most active wards in Nalolo District of the Western Province of Zambia. Action Aid Zambia paid the ward a visit to hear out on the impact of the DTV Water is Life project.
My full names are Manix Manyando Mushokavanj, Ward Councillor for Nanjucha Ward of Nalolo District. Before Action Aid came to exist in Nanjucha Ward, people used to drink water as natural as it was from our traditional wells. People had no basic knowledge of what clean drinking water is and what safe water is. So as such, we had experienced certain waterborne diseases like diarrhea, dysentery, typhoid. Now with the presence or the existence of Action Aid in the Nanjucha Ward, I'm glad to mention that people had access to basic knowledge of what clean drinking water is. We had lessons with the community together with Action Aid, the village indunas, teaching people what it means by clean drinking water. As such, people came to know how to boil their water. People started putting water in 20-liter containers in the sun. People were taught how to use chlorine. On top of that one, sanitation lessons were taught to our people, and the people were encouraged. We even demonstrated how to build bathing stands. We demonstrated to our people how to dig sunk-in pit latrines and dig rubbish pits. So the area of sanitation, as I'm saying now, in Nanjucha is sound, and people have explained that there is a reduction in waterborne diseases. The existence of Action Aid has totally helped our people. After receiving that basic knowledge, people now are implementing, are drinking clean drinking water. One of the benefits is people are living in health conditions. The other one is even the animals, chickens, dogs, cattle are drinking safe drinking water. Action Aid went to the extent of training our people how to dredge their canal. Now, as I'm saying, we had 50 beneficiaries, 25 from Lubosi, 25 from Litoya, whereby we issued 20 shovels, 10 on the other side, 10 on the other side, together with the safety boots, gum boots, helmets, slashers, to use when dredging the canal. So the canal from Litoya in the northern part to the bridge at Lubosi is being dredged. Now we are trying by all means to involve the people on the western side of the road so that they do like what the people on the eastern side have done. People are able, we can see in our courtyards around, they've got plate stands, they've got bath stands, they've got toilets, and so on. People are living in a hygienic way. That's one of the benefits that Action Aid has done. Apart from that one, we have a borehole which we can point today at Nanjucha Primary School, which was sunk by Action Aid. One of the achievements that we can point at today is that we were facilitated with 5 computers which are now at Litoya's Primary School where I'm standing here. And this time around, we are strategizing on the western part of the Lubosi Bridge, whereby we want to involve our people, our traditional leaders, the BRE, and Action Aid so that we can dredge that canal up to the Zambezi River. We had a challenge when we were training our people at Lubosi Bridge because they were given helmets and gumboots, slashers, and shovels. People who saw them thought that they are employed. As such, they shunned to go into the canal. So we are going around explaining to them that these tools are not for individuals, but for the benefit of the people of Nanjucha. Everybody who wants to go into the canal and dredge is welcome to come and use the tools. So we want to go in the canal, dredge it until we reach Murie, where it reaches the Zambezi River Skwenga area. It is my appeal today that Action Aid should come to stay in Nanjucha. The reason being, one, our people are acquainted to the working pattern of Action Aid. As such, they are seeing things which Action Aid has brought into them. From there, they have the youth groups which goes around educating masses just around on their rights, on how they are going to sustain themselves to become entrepreneurs, and how they should look at each other's neighbor. They even discourage early marriages among our children. So Action Aid, having it in Nanjucha today is a blessing because people already know what it is. they are more or less like Nanjucha residents.
Livizo laka kina induna situmbeko nizwa mamuzi obizwa kabula masilalo sana Njucha kuinduna kuchifieri ya indopo chele kuzwa koma kalelo kupilobalo na bamezi nesi bobunde nunwa mezi amama sima ana eza kuli nilukopa na amate niliko kwani nilimbotwe mani nilinoa ze mulikutoyubanga mama sima chele mezi aluna nesi amande nunwa likaze fosalila ulu chele project ye ayota situfumana kuilikazale za fela kulichwe sabatolo tomela lipombi mosolo nunwa mezi amande na kwechwa na soluzi baku ya ama toileti soluzi baku fiela pali bakazaluna li mama la paluna lichika zaluna zali soluzi paikanga pali kota mezi aluna soluzi anga bate ni miliani mbalulutezi chwe likakau sana kwezo kuna ni chinjo yetu na olukuzwa muno luinezi koma kalelo ni lunyanda mezi chwe mezi solufu manabu kaufa ku ilipombi balubezi zona paka ufi chwe lusolunwa mezi amande mane ni kuitutaku ya ama toileti kweza misebezi kaufa ebonta serumena ni makete batanga batubona bayerusi kutolutanga neli wana babatire kutolufanisaka chekuba nibona batanga kutolutanga tulezanga mikopano yakuli lubaba lelema basyalu na lubaba leli kakao fela zelu soli kweza kaufela kona lebu itumelo bwalu na bolu itumela kwina kuna ni chenju kuzwa kuma kalelo lichenjo ese liliteni solunwa mezi amande alusa nwa mezi akukopana nilimbotwe nilinoa mateni kona kusolunwa mezi alwa kwali pompi azo mamuvu chwe mezi ano solunwa na kwesele amande aisali amasila kona mezi solunwa na kwe kakwe chinjo ese lietu na ulu kakwe tikaze solubona seze ngata zabalukiselize chwe likazo kaufela zutise zatabo akusana butata bosolufumana sulu kwa side koni pilana akusana butata bolufumana bwa mezi kwa teni sulu batoko yakiba takuli kuzwa kuma kalelo balubontize bunde bwabona chwe nipo na paulu batakuli basikiba kutamamulao bazwele pili kulutusa kakwi lutaimange kwa siba kakoli wiziru na kwani kwana Njucha lunaniliabwa lukataza leliza kwina ukafa lutise za mezi nelicho zapala kufumane ande chono kupakuli bakambe kwa konala baluba teneli machine yata kututusa kutokoela liabo laluna kuli meza alpe mateni batu balime ande bafumane njimo bafumane za kucha kona takalio lukupakuli batu babasikiba kutamamulao bazwele pili na chwalo
mabiso akakakala kina consilia mulema mbela nina mwana Njucha nifumane ya mwasibaka salubosi lubeleke ni ba action aid kwa mana makatengo kaba maza support group miko amana ka maza support group kubelekisana ni ba action aid no batoluluta kwa mana kakufumana mezi amande kunwa mezi amande akenire kasamulao niluziereye kakuliluna lubasali niluzamanga lihola zeterere kubata mezi akenire mane noluyemelanga mwami line kono action aid seto kala kubeleka niluna miase kala kubeleka nuna action aid kulufasikuka moruka kona kufumanira mezi akenire kachwale fa kakuba musali lubona kulikelu lukulu wamane ni matuku neli amanga atasapiri kakuli banana masibaka nafumanira kuli bakula bakatazea kono fa selfumana kuli miline ne ivanga tene emiterere iferire kuzafate ni butuku mwamwamba sebona ukutafa fasi
mabizo akakutela kina mwala mukela ni mweterere wa squat sababancha malito ya salito ya youth organization project ye foi karazia DSTV kuzoma 2016 iska kale no lunani matata amezi matukwa na tswaki mezi nila mangata oluno kufumania kuli ni mwali kolo ni kwali patela kafala paloneze yekezea kono asamulao sebati silitoze kakuba muyemere wa babancha nikonile kukwetela squat saka nikuluta babancha abanzi ma community yaro na moka ofela kamomezi akona kuitusezwa kakukena kakwitusa chlorine kuyani afalizazi amochiro maneni nikubirisa alubulera fachwana sichaba babangata sichaba sakafela sababancha sisinanizibo kakuba mweterere wa babancha kwa Nalolo ntabela kulikambelo azwela pilini ba action aid nisebezi yabona bakinsa kuli ki katengo kakamweza ulu nikutisa linongezo no lufalo na ma community yaluna kakuba muyemere babancha ntabela fateni kuli babancha bafirema trainings ashutana mwakona kulukisiza lipompze shwire ilikuli sichaba sikoni kubase singata situ samize akenile chwale ni tume la hulu kakuli Action Aid kiona katengo kao fela kakonile kupira linongosi za luna mi lwatavela kuluzwele pili nikona mi katosfali sana ni baba nchabo sata momulao itumezi
ona kina imbo wa mushova ba Action Aid batulolutire mwakukeniseza lya bwalaluna mikukenisa lya bwalaluna kikuli lukutule mezi mimezi ale olukutula kikuli alutuse kwa magadeni aluna kwa kuselaela kama garden aluna sinamubona ingefa kelukala kulima magadeni aluna kutahate ni rice kelulima rice aluna kiye kisalibona ba Action Aid batulolufali velekiso lifocholo mahala bingwe njule ni mayomenti ni majombo za kwitusisa alu tokola mwali abwalaluna mi musebezo lukalile mwa 2018 bona ba Action Aid abatuloluta kutokola liabwa mi kimusebezo lukazwela pili silimo seo na famwa June apelo akala kutokola na chwalo sina mobalutezi bona ba Action Aid ngeluzwela pili ona chwalo akimusebezo ezifela fasi bakafa kono yambala kanina njucha yo kafe akapalo kabule yakuli na lolo yo kafela batrenile batu mwateni chwalo mane ni rice lwali maraisi mezi ale olungamwa yolupompa mwali yabwa luswelwa selaila maraisi yaluna kikaufela.
In 2018, Action Aid Zambia established a training program for the community on the basics of how to clean canals and water harvesting.
I just want to give a short testimony on what Action Aid has done to our community as far as the clean drinking water is concerned. As I'm standing here, I'm standing on the southern bank of our canal that is merging from Litoya to Sikwenga. Action Aid came to our assistance in 2018 and they taught us the basic knowledge and the practical instructions on how to dredge a canal. This activity has benefited us in various ways that has boosted our economic activities in the area. Example given here, we have harvested the water. By harvesting the water, we have the capacity to control the water. That is making small canals that goes into our rice gardens, watering our vegetable gardens. Apart from that, we have controlled some of the water into fishing ponds, whereby we have a strategy whereby in the eastern side of the canal we have a fish pond around Mr. Mloda's area, and we are developing another fishing pond at a place called Malo. So even the life in the water is being controlled because the water is being harvested. All in all, we are appealing as a civic leader to Action Aid to come to our full assistance so that we may go even further than this. Thank you very much.
Before the DTV Water is Life project came to their aid, people of Nanjucha had no choice but to draw water from a nearby stream that was also used for many other unhealthy activities. School-going children were also in the count as this affected them both in their academical performance and presence.
Action Aid came in quickly with a positive result of putting this borehole you see here. The borehole was put. After it had been put, we saw a number of changes on the part of the community who are around the school and on the part of our learners, the pupils themselves, even us teachers. On the part of the people of the learners and the pupils themselves, they started taking clean water. The diseases that were about to occur in the school ceased. Our learners started drinking safe water and clean. From there, the late coming and the disturbance of our periods because of drawing water from the very far place reduced, and it is now no longer there. From there, the community, the villages around the school, they also started taking clean water from the Action Aid project. From the time it was put up to date, we haven't faced any problem or any challenge over the issue of one diseases. There are no diseases around the school or even around the community. People are now clean. Our children are now clean. The food that they take, it is prepared out of clean water. Even teachers' houses, the teachers' households, they draw clean water. Action aid should not come to an end in Zambia, especially in our locality here. Should action aid come to an end, to mean the end of some developmental projects here, especially water projects. So I think action aid should continue helping the community. Why? Because whenever we tell action aid, whenever action aid are told to come and intervene into a problem, especially water problem which I have seen, they come as quickly as they can. I think they are one of the most hard-working companies or projects among some of the projects in Zambia.
My name is Webster Ingwe. I'm from Nanjucha Primary School. The benefit of drinking this water is the children are drinking clean water.
As Action Aid Zambia, we are hoping by 2019 with this project we'll be able to have improved water access in Nalolo District based on accessibility, affordability, as well as availability of the water. We have been implementing the Nalolo Water Project funded by DTV in the past 2 years. And what we have observed is that through this project we have managed to reach more than 15,000 people in Nalolo, more particularly women and youths who have been brought on board. Through this project we have managed to reduce the unpaid care work of women in terms of the distances they cover to fetch for water, thereby being able to redistribute their time when it comes to handling other kind of work. In addition, the project has also helped in terms of addressing issues of waterborne diseases, such as if you look at in the area of Kataba Ward, where we were having a number of diarrheal diseases being recorded at Kataba Clinic, but looking at the coming on board of this project, it has reduced that. And also to mention that as Action Aid Zambia, we have been one of the first NGOs working in the water sector in Nalolo District, and this has managed to open up the area to bring on board more partners when it comes to working on issues of around water and hygiene and sanitation. Therefore, we are actually very proud in terms of the achievements we have made, where we have managed to bring more women to add on board and have them to have a say when it comes to the planning, as well as such as in the ward development committees. Through this project, we have also managed to produce one female councillor in Nalolo who is also quite active when it comes to issues of water, and making sure and ensuring that more women are brought on board in terms of having a voice, but also being part of the planning processes when it comes to water development committees as well as village water development committees. On the other hand, in terms of the education outcomes, this project has also led to increased attendancy when it comes to schools, mostly by the girl child, as most of them are involved in household chores when it comes to fetching water. So we have really seen the great benefits of this project in terms of what it has managed to score on the ground.
I'm Kritikos Patrick Nshindano. I'm with the Civil Society for Poverty Reduction, which is basically a network of CSOs formed to coordinate other CSOs to have input into national development planning, but later on also monitor their implementation. And CSPR has been a partner of Action Aid Zambia for a long time, and specifically partnered actually on the DTV project, which we popularly call as the Nalolo Water Project because of its location. And this is a project that has had a massive impact in terms of the well-being of people. First and foremost, I think one of the key takeaways is that this is an area that didn't have presence of civil society at the beginning of the project. but also faced a number of challenges with regards to access to clean and safe drinking water. And what the project tried to do was first to bring about an issue of awareness with regards to understanding the rights that people have in terms of promoting demand for services on the part of the government and, in short, duty bearers. And this is to bring about the much needed accountability that comes with service provision, but also that comes with the elections in terms of the ability to be able to vote. But beyond that is also to try and see how, as a program, it can integrate methodologies that can be used by the communities where the project was to give them or empower them with the necessary skills to undertake social accountability. So CSPR, in partnership with ActionAid Zambia, did conduct a lot of training for these communities, community groupings, starting from the young people, women, which were the main focus. This is the women and children, the youth specifically, but also was extended to the men, knowing that you cannot work in isolation when you're in a community, but to look at the impact. We did utilize scorecard methodologies. This is in terms of gathering data that then the community will be able to utilize in terms of evidence through interface meetings with service providers or duty bearers, as it were, to be able to demand for these services that they need. And within a very short period of time of implementation of government, and this is with the complementarity of the project in terms of drilling boreholes in that site, we did see government coming up and supplementing that role and bringing those services that we are lacking to those areas, both on the East and West Bank. And you realize that the terrain that we operated in is a terrain that most people, especially on the West Bank, people would not even dare to access because of the challenges that are there in terms of crossing the valley. It's a very terrible terrain. So it proved one of the biggest challenges in implementation of the project. But the rewards were really worthwhile in terms of the project implementation when you go there and you see the evidence of people, the level of awareness to the extent where even some of the trained citizens embarked on a political career in terms of councillorship, but beyond that, where you see the level of demand that is being exerted on duty bearers to be able to attract the much needed services in those areas. It's quite overwhelming. And but most importantly, it's the service itself. These are people that never had access to clean and safe water, but this time around, when you go in this area, you find these boreholes that have been put there. They might have challenges in terms of iodization, as it's called, and in terms of high content of iron, which again we need to work towards in terms of treating. But most boreholes have provided access to clean and safe water, where most women would wake up at very awkward hours as early as 04 to go to the valleys and streams to be able to draw water. Now they can access that water within manageable distances and become more productive. When you get to understand the setup within which most of these villages are and communities are set up, that's such that they take away a lot of productive time, especially from the women in that area, because they have to spend a lot of time to be able to gather water, not only for themselves but for their entire household. And again, when you look at the labor itself, most of the women are the ones that are involved in productive labor in terms of agriculture. And the project brought about not just service provision in terms of water, but also brought in an element of both income and food security at household level, because then more time was created for the women to be able to engage in more productive ventures and be able to provide for the families, as it were, and supplement the household heads in those households. And it's a project I strongly believe is one that can go documented as one of the most successful projects that we've implemented, and we hope that we can have a phase 2 of the project, because when you look at the scope of reach, it's a massive area, and we've only been able to touch a very small portion in terms of the geographical location, and we need to ensure that it's scaled up, especially on the West Bank, where most projects do not reach. We have a few new players that have gone to the area, but it still remains very limited, and the problem still remains grave, and there's urgent attention for more interventions there, but also to ensure that citizens still reinvigorated or reignited in terms of maintaining the social accountability training and be able to demand using a rights-based approach on a year-to-year basis. As you may know, when you're talking about social accountability, it's not a 1-year, 2-year project. This is a process because you are building people's level of awareness on their rights that they thought were privileged on the part of the state. When they received a school or a health post, they would think this is a privilege that government is offering. Meanwhile, it's a basic right that government has to ensure that it provides its citizens. So to be able to shift that culture from one that people are thinking they're basically being done favors to one of rights holder takes a while, and this is something that needs to be continued, and we need to continue as a project in terms of implementation and building the capacity of the communities. The strength of the project is just that, is to be able to transfer beyond the ability of the actors. This is Action Aid, CSPR, getting in there and providing the necessary skills. Our level of success will be to see to it that citizens in those areas are able to run on their own and be able to stand on their own in terms of accountability and holding their duty bearers to account without the backstopping of either organizations. And of course, we have seen that already come into fruition, but that has to be kept up for a couple of years so that it can be integrated within the thinking and culture of that communities.
With the completion of the Nalolo Water Project, funded by Danish Television and implemented by Action Aid Zambia, an organization that focuses on promoting women's rights, good governance, and targets on the improvement of the educational system, there is more room for further development in this district. Calling upon the engagement of more stakeholders to constantly participate and contribute towards the progression of many lives in Nalolo District is foremost.